We are going live. We are live now. Hello, very good afternoon, ladies and gentlemen. Welcome to our webinar, which is all about keeping healthcare technologies safe and sound. Today, we will be diving into the world where technology meets healthcare and making sure everything stays secure and which is a very important thing to make sure that everything is secure. Think about if we think about that in today's world, how healthcare technology is changing. We can now take care of patients from distance using gadgets like smart watches and glucose monitors. It's amazing, but it also brings new problems which we need to solve, like making sure nobody can hack into our gadgets and don't mess things up for us. Moreover, we'll delve into the latest achievements, advancements in encryption, anomaly detection system, and blockchain-based protocols, exploring how they are revolutionizing our healthcare IoT security. From zero trust architecture to quantum resistant cryptography, these emerging trends hold immense promise in fortifying our defense against evolving threats. We have got two experts with us today, and we are very privileged to have them here who are going to help us understand these challenges better. We'll talk about how they are using these and new technologies into these fancy healthcare systems to make sure that all gadgets and our privacy is secure. Plus, we'll also peek into how hospitals are keeping our private information safe, and also we'll discuss the rules about HIPAA and GDPR. We're going to discuss some super strong encryption and smart systems that can spot when something weird is happening. And yes, blockchain, we're going to discuss that also. And in the end, we'll finally gaze into the future, discussing the evolving regulatory landscape and outlook of the IoT security in healthcare. And for the audiences, if you have got questions, fire away. We are here from you. Yeah, we are here for you, and we'll be very happy and to give you the answers with the help of our experts present here. So once again, thank you everyone for joining us today. Let's jump right into and get to know our panelists and then learn from them how to keep our healthcare technology safe and secure. So here we have Mr. Santosh Kumar. I'm very delighted to introduce you to Mr. Santosh Kumar, who is currently serving as program manager at Bosch Global Software Technologies. He is currently in Bangalore. He has over 20 years of extensive experience in cybersecurity design and consulting. Mr. Kumar has worked across diverse range of industries, including healthcare, automotive, enterprises, shipping, power sector, smart cities, and Industry 4.0. His expertise also encompasses privacy topics, notably the implementation and of privacy enhancing technologies, that is PET. And we are also excited to have him share his deep insights and experiences over all these years with us today. Very welcome, sir, Santosh, sir.
Thank
And
you.
also Dr. Ramesh here with us. Dr. Dharavath Ramesh is an associate professor in IIT ISM. He has also done his PhD from the same college, and he has done his master's from Jawaharlal Nehru Technology University in computer science engineering with specialization in software engineering. His research interests wide ranging and include blockchain and distributed computing, cloud security, cloud storage and security, among a lot of other topics, which also include machine learning paradigms in agriculture. Also, Dr. Ramesh has published over 100 technical papers in referred journals, including IEEE, and is a senior member of IEEE and ASEM. Among his numerous accolades, he has received international research grants and was honored as the Best Researcher of the Year in 2018. We are privileged to have them both here to share their valuable knowledge and experience with us today. Now we'll go one by one with Santosh sir first. He will introduce himself for 5 minutes, and then 5 minutes will be dedicated to Ramesh sir, and then we begin our panel session, sir. So, Mr. Ramesh, Dr. Santosh, can we begin with you? Sorry, Mr.
Yeah, thank
Santosh, can we begin with you? And then
yeah,
we'll continue with Dr. Ramesh.
thank you, Niharika, for introduction. So, as Niharika has already introduced, I am Santosh, currently working as program manager at Bosch Global Software Technologies in Bengaluru. I have 20 plus years of experience in cybersecurity design and consulting, and various end-to-end cybersecurity requirements and as regard to healthcare, I have substantial experience in product security, Having worked with cybersecurity requirements of numerous healthcare products, including CGM devices, sleep apnea devices, respiratory aids, diagnostic devices like blood pressure monitoring kits, ECG machine, telehealth devices, or the remote patient monitoring systems, which entails securing device, application, as well as the cloud infrastructure. So we at Bosch provide cybersecurity product and managed services to clients around the world. Our approach is comprehensive and process driven, following security engineering process, which includes chip to cloud approach for the entire life cycle of the product. During the design and development phase, it includes conducting threat and risk assessment, or in short, we call it TARA, for the product. And based on the security needs, implementation of the product. Then follow up with independent verification and validation. Then penetration testing is undertaken to ensure that no bugs have been introduced while coding the product. So this is all into the development phase. In the post market phase, post launch phase, or the post market phase, we continue with security monitoring, vulnerability management, and setting and managing security operation centers for our customers around the world. Regular security audits and compliance checks are also conducted to identify vulnerabilities early and ensure regulatory standards are met. We also ensure that product retires and gets decommissioned security. S- So we ensure that no PII data or license are held in the product before being discarded. Additionally, we also undertake employees training on cybersecurity best practices, which can enhance staff awareness and responses to major threats. We stress on security development practices, integrating security into software development lifecycle. We call it security in design and default, which starts from the development stage. And also, we stress upon robust third party risk management, which is critical for maintaining the security of these healthcare systems. All our processes are aligned with ISO 81001, that is related to cybersecurity requirement in healthcare devices, and we support all our customers to comply with the local regulations like FDA, EDU, MDR, Health Canada, and other regional regulations related to that country. So over to you, Niharika.
Thank you so much, Santosh, Mr. Santosh. It's really enlightening to know that how you're working with the security audits and helping the other hospital healthcare thing for the compliances. And also, you talked about the local regulations like FDA and EDR. So we are really excited to know about these things in details. Dr. Ramesh, sir, can we have you next? Please give a brief introduction about yourself and your experiences.
Yeah. Thank you, Niharika, for inviting me. Yeah, so very good evening, okay, good evening to all of you, dear associates. It's my pleasure to have myself in this kind of platform to share my knowledge with respect to securing health care IoT systems. So, yeah, basically, I'm an academician. So, my nature of work is to teach, develop, and do research and implement integrated methodologies which are really beneficial for society up to some extent. And basically what an academician can do in terms of his contribution, his or her contributions. So coming to the part of my exposure towards towards as an academician here is that I have joined industry in 2005 as a database administrator, that is client, one of the client of Infosys, based on my the BTech expertise whatever I have gained the knowledge in terms of database management systems. Then worked for 1.5 to 2 years and felt nothing. So again decided to join the academics back. So on this decision, I came back and joined the academics and started exploring the things related to means towards research, development, and others. So finally, I had an opportunity to join the one of the premier institutes that is called Indian School of Mines during that time. And after completion of my PhD, I became a full-fledged professor in the Department of Computer Science and Engineering. So till 2015, I had explored so many things related to securing the database technologies, especially records. So I started my expertise in terms of developing secure cloud storage possibilities. So later on, I have compromised on some methodologies way that just producing and just developing related cryptographic methodologies are not much suitable to prevent um, very sensitive data of users, especially in terms of healthcare and others. So later on, I decided to work with blockchain related technology, and finally 2016-17 onwards, I started working with blockchain technology development process in terms of developing some required paradigms for securing healthcare records, as well as agriculture part also. So finally, what I observed from my research till today, especially related to securing the healthcare IoT systems. Though I don't have much knowledge, that is 100% knowledge in IoT systems. Being a computer science professor, I have some knowledge on securing the healthcare data when we receive from the various IoT devices. So the basic point comes in picture when the rapid integration of the IoT in healthcare has basically revolutionized patient care. Means it simply offers benefits such as real-time health monitoring, remote diagnostics, and improved management of chronic diseases. Okay, so this we can digitalize up to some extent. However, the increased connectivity and data exchange inherent in IoT systems also introduce significant security challenges. So this way, I try to explore the things and migrated from the cloud security just by integrating the concept of cloud database storage with blockchain technology. So there I found really a good knowledge and developed some required paradigms which are really beneficial for society, especially in terms of Indian culture. Okay, so this ensures the security of healthcare, especially IoT, I call HIOT. So systems is crucial to protect sensitive patient data and maintain the integrity and availability of healthcare services. So as a profound research part, the two key challenges I have observed. The first one is the data's privacy and confidentiality with respect to patient data and encryption, and second one is device authentication and authorization. So these are the two terms I have included and still I am doing in terms of research and getting good number of grants to produce relevant technologies which are really helpful for the society. Yeah, thank you, Niharika. This is over to you. This is my simple introduction.
Thank you so much, sir. Thank you so much, Dr. Ramesh. Thank you so much, Mr. Santosh. Now, to the audiences, we are going to begin our panel discussion after the introduction part. So, I'd also request that you can post your questions in the comment box. So, and we can after the session over, we have dedicated 10 minutes for the question and answer directly live from the experts. You can keep posting, and we in the end we'll fire up these questions to the experts, and they'll answer it live. And as we have known already that we are fortunate enough to have two esteemed experts joining us, who is one from the industry point of view. We'll be having the question, we'll be having the experience and all the knowledges from the industry point of view. The other is from the academia. So they provide us very valuable insights in their respective fields and share their experiences of unique perspectives on the topic, which is we are in the hand that is securing healthcare IoT system. So let's begin our discussion. So our first question for I like we can begin discussing how what is the security and threat landscape that is when it comes to healthcare, especially in the recent advancement in the remote patient care. As we have seen that we have so many advancement in the remote patient care, we have so many technology development. So according to you, sir, according to the industry point of view, according to the academia point of view, what are the threat landscape and how we are going to handle it? So let's begin with
So,
Mr. Santosh, and then Dr. Ramesh will continue.
yeah. So, as regard to the security landscape in healthcare, particularly with the rise of remote patient monitoring, has become very complex. The remote monitoring devices require real-time data security and have significantly increased in numbers and also have increased the potential entry points and threat surface for cyber attackers. So with privacy laws in place in most of the countries, personal health information, that is PHI, is highly sensitive nowadays, and its compromise can lead to severe privacy violation and identity theft. So compliances with regulations such as GDPR, HIPAA, and other local data protection laws add another layer of security requirements. Also, the emergence of software as a medical device, which is a software which operates independently of the hardware and uses AI and ML tools for predictive analytics and personalized medicines, also raise concern about data privacy and the security of AI ML models. Also, I would just like to mention that though with the technology advancement, remote monitoring devices and mobile healthcare applications have improved healthcare delivery, but also introduced new security challenges. The interconnectivity of clouds with EMR data, or the format of EMR data, has enabled centralization of patient data, however, making these systems prime target for cyber attackers.
Yeah. So yeah, I would like to add further to this. Yeah, thank you, Santosh, for your good words. Yeah, but when we consider the concept of healthcare records, basically the device authentication and authorization comes in picture. This is really a difficult part to maintain, where secure access must be provided in terms of all the way, that is starting from the data sharing, starting from the point of data sharing from the user, means like the patient, to the hospital, and wherever the hospital judges the information and suggests the relevant treatment, something. So there, the part of secure access comes in picture. So ensuring that only authorized devices and users can access the network is critical, very critical. Means this involves robust authentication mechanisms and access control policies. So if you speak in detail about access control policies, this is not even again not very much easy to maintain from the cloud point of view. Why? Because nowadays we guys, means we all are habituated in using devices and generating the data. It's millions of people are using and generating the data in a huge way. And handling that such kind of big data and processing towards dissemination is not an easy process. And the second thing is like identity management. So proper identity management systems are needed to track and verify devices and users within the health IoT ecosystem. So such kind of strategy must be developed in terms of applying different type of validated machine learning mechanisms. Why? Because whenever the data goes for validation, sorry, processing, then a kind of machine learning paradigm must be applied. So how it has been applied, and even after applying, then after disseminating the suitable results, up to what extent the data which has been collected from the user is secure, right? This is the one. And second point is data integrity and accuracy. Means in terms of tampering, as Santosh has rightly pointed out, like protecting data from tampering and ensuring its integrity as it moves between the devices and systems is really vital. So techniques such as digital signatures, okay, and checksums can help verify data integrity. So for this, again, one, the designer or the developer must need to work on this to maintain the secrecy in a standard way. And the second one is accuracy. So ensuring the data collected and transmitted by IoT devices is really accurate and reliable, and which must be essential for effective patient care as well. And these two factors must be depending on another new factor, that is called system availability. Means that we need to consider again two sub-phases under this concept, that is downtime and redundancy. Say healthcare IoT system must be resilient to attack, basically, that would disrupt services such as distributed, means denial of services, DDoS attack we call in our academic language. And second subphase is redundancy. Whereas implementing redundancy and failover mechanisms can help maintain system availability and reliability. So these are my concerns related to the question asked by one of the entities. Thank you.
So I fully agree with. I just want to comment. Agree with Dr. Ramesh. as regard to device security, we are into that business. So we ensure that the secure boot and secure access for firmware updates, which ensure the device start with the trusted software and receive regular security updates, and are protected from all kind of vulnerabilities. So we do such kind of implementation, we do certificate based authentication. So we are into this business. And also we are into secure access of devices, patch management through FOTA or SOTA, or firmware update over there, and so, or you can say software update over there. So we secure that communication update also for the patch management, which takes over the line. So we are into it, and it's a very important point what Dr. Ramesh brought out was the security of the device, or any healthcare device, medical device, is a paramount.
See, this is
Yeah.
how we
Yeah,
get to
please,
know
please.
that what researchers are working on and how industry is actually working on those things, because there is a gap between what the researchers are doing and what industry is doing. So if we, this is why this webinar is there, to patch up things, to know actually the researchers what actually work is going on in academia, it's actually being worked on, and what lack, what gap is there. So further, you were saying something, Dr. Ramesh, or should we move to the next topic?
Yeah, yeah. So yeah, great. Then I would like to further add some more points to the words of Santosh. Yes, you are really doing a good job. Then to further add, this is the part of related to physical security of the device, like device protection. Okay. So basically, IoT devices are often deployed in diverse environments. Yeah. So some of like which may be unsecured. Yeah, maybe mostly that we feel like it's 70+%. So physical security measures are really necessary to prevent theft, tampering, or damage to devices. So best practices for securing healthcare related IoT systems would be, right. So basically, we follow the structure of some kind of mechanisms to develop some related paradigms on how to protect this. But because see, we are being an academician, that I don't have much knowledge in developing the suitable framework and doing the testing, right, and performing the validations day by day based on the versions of the software being developed. So what we do that we try to potentialize the things in terms of developing some secure mechanisms towards like comprehensive risk assessment. So this is the part of the software industry where they can conduct regular risk assessments to identify and address potential security vulnerabilities in the infrastructure of healthcare IoT systems itself. They can do it, right?
Yes.
But because in making up the things just by taking the format, they say, for example, that I can give the knowledge of developing an engine for a car, but building the complete body to run the entire car is completely depending upon the industry people who are having great expertise like Santosh. Yeah.
So,
Yes.
So
Dr.
this way,
Ramesh, you are correct.
We have
So the
actually
approach here
time
normally is,
constraints, so I was
yeah,
thinking we can move ahead in the second topic, and then we'll keep discussing
yeah,
things, because we have
yeah.
time
I'll
constraints.
bring out that approach in the next
It's
topic,
such a
and
vast
because that
topic.
is
We
very
just
required. Yeah.
keep going on, yeah.
yeah.
So, like we know that these days many people, they have healthcare devices like smart watches, BP monitors, glucose monitors, etc. With which is with them on them regularly 24/7. So, what are the some standards for security and privacy in consumer healthcare products, which our users and our clients and our audiences, they should know that these are our security and privacy standards which the company should follow, the users should know, they should be aware of. So, Mr. Santosh, can you
So,
start?
yeah. So, as regard to standards, so in addition to ISO 27001, which is the standard framework for implementing information security management system (ISMS), we have IEC 81001 stroke 5 stroke 1, which was latest as 2021, which deals with health software security for in its entire product life cycle. And then we have IEC 62304, which talks of life cycle requirement for medical devices software. So as regard to privacy is concerned, we have a ISO 27701, which is an extension of 27001, which focuses on privacy information management. In addition, local geographical laws like GDPR, HIPAA, Health Canada provides requirement of handling personal data at regional level. As regard to cryptographic devices that handle sensitive data, they must comply with FIPS standard, basically FIPS 140-2, to validate whether those cryptographic modules do ensure security. So these are by and large the standards which are mostly applicable beyond regulations like FDA regulation and MDR. So I'm only talking of standard. These are the standards normally applicable to healthcare.
Good. Yes, it's really good. Nice. I mean, really good to know about the standards you guys are maintaining in terms of developing something.
So,
Great.
to your question, Dr. Ramesh, so what you were asking about risk management and security. So, in industry, what happens that in company like us, we start very early in the product life cycle. That means whenever we initiate any product, we start with security risk assessment. That is, we do threat assessment and TARA, threat assessment and risk analysis, where we find out what is the security need for this product, whether it is a
Great.
device, cloud, or anything. And based on these needs, this could be technical measures, terms, technical or organization measures, or physical security. Based on these, we make concepts or implement those measures, and this is carried forward into the entire product life cycle. Basically, the approach is always security by design and default.
Great.
That's all.
So one question comes from my mind. Okay, good. Then development terms of regulations, it was really good to know from your end. Then how the end-to-end encryption has been preserved, end-to-end encryption, like using end-to-end encryption for all transmitted between data transmitted between the IoT devices and the central systems or distributed systems to protect data in transit and rest.
So
Okay.
it all comes out of this. Are you asking me a question or you are giving an answer?
So I'm giving you an answer. Like, why? Because
Okay, okay.
robust authentication mechanisms are required. Basically, what I understood from last 7 to 8 years when I visited again the healthcare system of UK, that is United Kingdom, they are really good in managing their healthcare system in all the way. And what I like most from their management is like robust authentication mechanisms, like implementing multi-factor authentication and robust access control policies in order to ensure that only authorized users and devices can access the network or the system. Okay, this was really good that I couldn't see, and even I couldn't have the knowledge about such kind of implementation in India today. But because as compared to the population that below 50%, 50% people are still doing like this. Like we kind of guys like who are educated are managing the activities day to day, like in a proper way that we are able to manage the things. But whenever it comes to the part of middle class population, this is really hard to manage. But because nowadays guys are having, everyone is having um, um, uh, device in their hand, like smart device. So this is very easy to manage. But whenever the part of usage comes in picture, robust authentication mechanism management from the industry who has developed is really difficult. Anyways, it's a good option that to hear from your end. Thank you very much.
So we actually take authentication and authorization very critical. So normally it is role-based access control mechanism, which restricts system access based on the user's role. That is the normal approach. But if it is a sensitive data or a server or something, we are certainly, as per the threat and risk assessment security needs, we get into multi-party authentication and other requirements which is required. Also, in many cases, we ensure authentication. If it is a very critical system, we always require a certificate based authentication. Suppose a device wants to communicate with the server, a TLS communication, so we ensure
Okay.
that at least the server side authentication is there. But if the security risk is much more, or if the customer appetite or requirement for security more, we ensure that a certificate authentication is there from both device and the server. So that is one of the major aspects which is expected, at least by the global customers. We work for a lot of global customers, and their expectation is always to ensure authentication, authorization, though it costs, but then the system remains secure.
Great, great. Thank you. Yeah.
Thank you so much,
So,
Ramesh sir and Santosh sir.
yeah.
So let's move to another thing, as we have already covered the technologies, how their compliances and requirements are being met by the industries. So we can move ahead now to just to get an idea that how we can elaborate the latest advancement in end-to-end encryption, AI-driven anomaly detection systems, and blockchain-based secure data securing protocols and all. And we can discuss the emerging trends in IoT security frameworks, which we see that with the new technologies and new devices coming in here. So how can we ensure that zero trust architectures and quantum resistant cryptography that are poised to tackle these challenges in near future? So can you elaborate that how these latest advancement are bothering and how these are being tackled by the healthcare?
Okay. So, as regard to end-to-end encryption, we recommend communication protocols such as TLS 1.2, if not 1.3, which is in some cases not possible to implement because of old systems. So, this ensures communication between the device and services are secure. We do recommend certificate-based authentication to our customers. We recommend AES 256 GCM for their to balance their security and the efficiency. So based on what is the requirement, what is the server configuration, so these encryption algorithms are recommend. We are also using PET, privacy enhancing techniques, to secure data like homomorphic encryption, which allows computation to be performed of encrypted data without decrypting it. We have worked on secure multi-party computation, which provides data minimization and security by allowing different parties to jointly perform some operation or a combined operation without any party needing to share all of its data. So these are some of the things which we have done in regard to end-to-end encryption and encryption. As regard to AI driven anomaly detection, we are using anomaly detectors in SIEMs. So as part of the operation of a healthcare device, we set up security operation centers. So in security operation center, we set up SIMs. SIMs is security incident and event management. Basically, there are a lot of SIMs available like Splunk, ArcSight, QRadar. So based on what is the requirement of the customer, we set up these SIMs, and there we have implemented AI driven anomaly detectors. So basically they identify potential security threats and detect unusual activities that may indicate breach. So this is a proactive approach. We run these security operations center 24 into 7, and they're manned all the time, and most of our customers in North America or Europe, as per their compliances, they need to comply with vulnerability management and setting of security operation center as part of their post market requirements. So as regard to now, next coming to what you talked about, blockchain. So again, blockchain provides a decentralized and secure way of share data. We have used blockchain for one of our pharmacy customer for its supply chain management, and we are also working on some smart contracts and other field using basically it is a sister field of cryptography. So we are into a lot of projects where we use blockchain. As regard to post quantum cryptography, so because there is a potential threat of computers breaking classical encryption mechanism, basically related to factorization, that is asymmetric keys, RSA and ECC. For symmetric and hashed, I don't think there is much of a problem as of now. So here we have a research team who work on post quantum cryptographic implementation into devices. So beside medical devices, we also have automotive devices. So we are implementing such algorithms within the devices, and now so there is a lot of requirement from the customer, and also they are also scared about this. So maybe what time, another 2 3 years it will take, sure algorithm will take to break this thing, but then we are already prepared for this. So as regard to zero trust security, this framework operates on the principle that no entity inside or outside the network should be trusted by default. Key elements include basically micro segmentation, which involves driving the network into smaller segments to limit the spread of breaches and simplicity. And we are working into this field, and this is also one of our 40 on which we are working.
Yeah, so great attentiveness towards. And Santosh ji, have you heard about like any implementation have been done at your end related to federated learning? Federated learning.
Yes. We
Hmm.
use
Yeah.
for our hospital customers.
Oh,
One
great.
of the
So I
project we have
really,
worked on federated learning. Most of the PETs almost we have worked on around 10 to 15 such PETs. This is I am also working on these fields, so we have worked on.
yeah, this way that we can monitor and perform the anomaly detection very easy. Why? Because
Yes,
so as you rightly pointed out, like up to some extent, being a customer, that I'm really scared of, like sharing my data. So up to what extent the other entity can give the assurance to my data. So for this initial, you can give a kind of assurance in terms of just by applying homomorphic encryption type of standards when the data is collected from the customer, then as usual in the stack of the customer, the data will be remain same. So the converted data will go for operation. Then whenever the part of predator learning comes in picture, there you can do just by applying that AI driven application in terms of machine
yes,
learning, right? Performing kind of processing. Again, okay, fine, it will perform and it will generate a suitable result, and the result will be shared back to the customer that based on or the user based on the provided data from your end. This kind of information has been retrieved in terms of processing. And again, if the user is having any concern about these are the data, then we can showcase like this is the encrypted data that we have received from at our end, and we have performed and the original data received from you, like this. We can give a kind of assurance in terms of privacy preserving mechanism. That way that we can create a belief among the user community like your data doesn't go somewhere, like this. This is the one. Yeah, and coming to the part of blockchain technology, that blockchain technology can be used in different parts of implementation. So mostly that being an academician, what I understood here is that it gives a great security in terms of immutable records, of storing immutable records up to some extent. And even the latest technology has come in picture in today, like even if he has the access on, even if he has the owner of the blockchain, even he can exchange or modify the existing block, right, by doing something. So this is called another technology that came in the market. Okay, so that is reducible blockchain. Well, because sometimes like it may happen like when user one goes to hospital one, there his or her disease was diagnosed and a kind of report has been generated by doctor one. So that will be in the start of the user with by taking the consent of the user in terms of providing credentials to him or her, right? The data can be secured at his hand and in the blockchain, like whenever the user wants to retrieve or read or showcase something, he or she can. Now, the user wants to go to the hospital number two, where the doctor two wants his previous history. Right. Again, the same can be shared based on the intention of the user, like that this is the previous history I had related to my problem, something health problem. This way he can show. Then based on the previous history and the current problem, again the doctor too can write something and suggest suggestions in treatment. Again, the same can be stored. Again, the same can be stored in his private block, like this. So this way, the information can be maintained. But one more important point we need to observe here is that is network segmentation. So this I really do not know that I am seeking help from Santosh, that where entire throughout the world, like I mean throughout the region, the Asian region, that the different type of devices are participating in such kind of data management. That how to segment the network management system. So this is really I do not know, but because people from different type of regions are participating in sharing their data to us, and this is really difficult. This is really a difficult challenge to process the data from various regions when the network is segmented.
so yeah,
So this,
Doc,
yeah.
So, Dr. Ramesh, certainly, as you brought out federated learning, we have worked with some of our customers both in centralized and decentralized federated learning approach, where we it's used to train machine learning models to in a basically distributed setting while minimizing the amount of personal data. That is also a requirement as regard to GDPR. So they want
Okay.
about data minimization. So because of data minimization requirements and limited data which is to be used by from privacy data measures, these are the PET technologies. Beyond that, we also work on differential privacy. We also on the synthetic data to
Okay.
train our
Okay.
models. So these are the topics. Homomorphic I also brought out. We also work on zero trust proofs. So most of the PET technologies we have worked on. So as regard to what you talked about segmentation, so in security in our organization, we always work on the concept of layered approach or defense
Oh,
in depth. So that is the if you follow that, certainly you will be able to segment your architecture, and so that one person cannot just enter. So the level is escalated that from if you enter a boundary, then the real authentication authorization mechanisms are required. So we work on the principle of layered approach, or you can call it defense in depth.
good, good, fine. And yeah, as Niharika was asking about the usage of quantum cryptography, so it will
Yes.
help us in making the operations more faster in terms of that is execution by utilizing the resources. So that's the thing. See, nothing is new. Quantum cryptography is not new. It's not a new thing. Like, so we are evolutionizing the things which are being adopted today. Say, for example, that initially when you ask a fifth standard student, just tell A plus B whole square formula. Okay, he or she can. But in order to minimize that kind of equation and making the things quite more faster, right, will help in terms of quantum cryptography. We are not going to introduce new things, but it will help in making the process more faster in terms of execution and processing the data. So this is my concern. Though I have not used the concept still I'm working with blockchain related mechanisms. Okay. When this blockchain area exhausted, then I move to the next part of invention only. Yeah, thank you.
Yeah.
Great.
Yes.
Any questions?
As we have been discussing
Yeah.
all these technologies, sir, our next topic of discussion can be get what is the future outlook? That is, what are the regulations and policies on IoT security in healthcare which we can look up to, and which, according to the new technologies which are about to come and develop in like when we
Okay.
discuss blockchain, how we are going to adopt these things, and yeah, we can discuss
So
through the
basically, yeah. So the future of IoT security, to be
in healthcare.
specific,
Yeah.
and in healthcare, will see more stringent regulation and enhanced compliances measures. Actually, COVID-19 pandemic has accelerated the adoption of IoT devices in healthcare. And after that, regulatory bodies like FDA have expanded guidelines to include robust cybersecurity requirements for IoT devices, focusing on security software development as well as pre-market and post-market security requirements and regular update features. So they FDA came up with a Consolidated Appropriation Act, or the Omnibus, in 2023, which talks of both pre-market and post-market, and they are very they want people to monitor their products and give the report to them regularly. So these are the policy requirements which have come in respect to most of the countries as part of regulations. As regard to policy development,
Yes.
with a huge spike in IoT devices, certainly governments will introduce in some initiative to improve IoT security infrastructure and best practices. We already have regulation on security as software as a medical devices by CDSCO, that is Central Drug Standard Control Organization of India. So they are also they have the regulation on medical devices 2017. They have the regulations on medical devices, how it is to be operated, how security needs to be carried on these devices throughout the life cycle. So also, in addition to this, would be public private partnership that will become more common, fostering collaboration between government agencies, healthcare providers, technological companies to develop efficient security framework. And there would be a sharing of threat intelligence. As per the FDA regulations, they ensure that all their healthcare firms share their vulnerabilities to each other, so that everybody is aware that what kind of vulnerabilities have been introduced with the latest softwares. As regard to technology advancement, what you talked of, it will play a critical role in enhancing IoT security. AI and machine learning will be integrated into security system to detect and respond to threats in real time by analyzing patient's data and provide anomalies. As sir also brought out, Dr. Ramesh brought out, blockchain technology will provide a secure framework, and also secure framework for supply chain data exchange, ensuring integrity and transparency into the system. So nobody denies it. So everything is transparent. Uh, Also, I brought out, we have a research team on quantum computing, post quantum cryptographies, which is gaining a lot of momentum now. And we are preparing ourselves for the future quantum computer threats and ensuring security of these IoT devices. So, in my opinion, the future outlook for IoT device in healthcare is shaped by evolving regulations, policies, technological advancements, and is aimed at addressing the increasing complexities and risks associated with such connected devices.
Yeah, thank you so much, sir. We'll hear our Dr. Ramesh views on this. Just a quick
Yeah,
reminder to the audiences, we will be
yeah,
taking up questions in next 10 minutes, like next 5 minutes. So please keep
yeah.
posting your questions here. We have so far got through three questions, but a quick reminder to all the audiences, we have a very good chance in hand where we can directly ask live questions from the experts in the fields, from industry, from the academia. Those from the industry can ask from Dr. Santosh, Mr. Santosh. Those from the academia, you are into research, please post your questions here. It's a live and very exclusive offer for all of you. So, Dr. Ramesh, your quick view on this future outlook, and then we'll take up the
Yeah,
questions.
great. Yeah, yeah, great. Thank you, Santosh, for your deliverable things. Side. Really good. So this is the part of development side. Then, on the other hand, that employee training and awareness is a must required thing in the current scenario of our society. Why? Because see that we have good number of software developments, um, and that even government is also supporting with regulate good number of regulations to adapt this one. But the users or the people means doesn't know about this. So in this case, like employee training and awareness is required. Why? Because train healthcare staff and IT personnel on the importance of cybersecurity and best practices for maintaining this security of healthcare IoT systems will create an impact, especially a big population country like us. This is one. And the most challenging issue from the developer side, like you, is like safeguarding against potential risks. So for this, that day by day the new technologies are taking their birth, and again giving a challenge, and again keeping a space for us to utilize them and monitor them and provide best practices to the user community. In the sense like securing, especially healthcare IoT systems, is a basically a multi-faceted challenge that requires a comprehensive approach in terms of like just integrating advanced technologies and the best practices to protect sensitive patient data to ensure the reliable operations of healthcare services. Yeah, and I really means I do agree with you. Like by addressing key security challenges and implementing robust security measures, healthcare providers can harness the benefits of IoT while safeguarding against potential risks. So this
Thank
I
you.
really, yeah. Thank you.
Thank you, Dr. Ramesh. Thank you, Mr. Santosh. Now we can quickly take up the questions. So, first question
Yeah.
we have here is dedicated to Mr. Santosh. That we talked about SOC implementation. So, this SOC implementation with SIAM, is it at the customer premises or where?
So it is based on the requirement of the customer. So
Sure.
some compliances like Middle East, they expect that these SOC should be run in their premise. However, compliance in North America, European Union, India, and all those things, they don't require this to be run. However, they have some restriction related to privacy of data. So they want their data to be hosted in their region. However, they can be monitored in our locations in India, so that is not an issue. So it all dependent on respective country compliances.
So, next question is, what are the various product security test certifications available at this moment?
So as of now, you need to comply with the standards. So if you comply with the standards of 81001, that is the healthcare software security standard. So if you comply with that standard, you can take that standard, and that could be an assurance for that you are complying with the security of your product for its entire life cycle. However, when it comes to certification, every country has a different certification. FDA is a regulation which requires some compliances to be made, and then they certify you, yes, you are okay with it. European MDA would require subs. So there is no
Yes.
specific certification per se. Maybe for a device could be there, like CGM device, glucose monitoring device. So they may come out, those consortiums may come out with some certification, but there is no universal certification for this. You need to follow the standards, you need to comply with the regulation of the respective countries, and then you get certified that yes, you are complying with their requirements.
Yeah, thank you, sir. So, next question is, this is like a National Trust Center set up by DOT is addressing the mandatory testing and certification of IoT devices or applications in all domains.
So
So,
thus this must be within India. I am not
India, yes.
very sure about it, but uh, is it compliant? It is mandatory or not? I'm not sure. Basically, health, when it is concerned into healthcare systems in India, it is controlled by, I just spoke about this thing. So there are regulations related to healthcare within the Indian system, and controlled by Central Drug Standard Control Organization, that is known as CDSCO. So they have come out with medical device rules. So they, you need to comply with those rules, and security is part of it. As related to IoT devices could be used in any domain. It need not be
Yes.
in healthcare. So could be such compliances, but they're not very mandatory for healthcare devices.
sure, sir. So we have one more comment from Dr.
Okay.
Sarat saying that discussion is very well structured, giving insights into present and future security of healthcare IoT systems, exploring AI, blockchain tech, standards, regulations, and policies. Thanks you to the speakers, he's saying. Thank you, Sarat, sir. And now also we have, let's, any closing remark from Santosh sir and Ramesh sir? We'll be just ending the session then.
Yeah, fine. So this is not the platform to discuss, but anyways, then being an academician that I have observed a great potentiality in terms of competitiveness in our large population country. So whenever any entity, means research entity comes with an idea, like it will go under rigorous review process, and based on the knowledge of the experts, the same would be recommended. Okay. So likewise, that sorting of idea is good, but like means recommending the things quickly is really required. But because who knows, like even a fifth standard child can also give one excellent idea to us, right? So people are having means interpretations based on their intelligence. So that intelligence must be required a kind of support in terms of regulatory authority. Say just now, one of the candidate pointed on an issue related to the IoT devices certification something. If I speak about European countries, they are maintaining standard mechanisms, right? In testing, validating, and finally adopting their services. So the countries like Europe, US, and others, then they are really faster in managing and supporting the entrepreneurs like that who are coming with good idea. So this is lacking. This is lacking in our India. Well, because I don't know, maybe some kind of restrictions are there from the government side and something. Okay. So in the year of 2017 itself, I have proposed one good idea, that is integrating the healthcare sector from the primary healthcare system to the large scale of healthcare system. But it was not true. But see, certainly the same was approved by Saudi Arabian government. Yes, they took my idea and they have implemented the thing. So still they are doing like this.
Nice.
Anyways,
Okay.
some kind of restrictions might be there, but
Yes.
the realistic things must be accepted for the beneficial of society. This is my intention. That's it.
I totally agree,
Yeah,
sir.
and I really feeling so happy to have a great eminent person like Santosh in our panel discussion
Same.
to learn something really good. Thank you.
Same here, Dr. Ramesh.
Yeah.
So,
So,
my view is with technology advancement, we are having increasing complexity and risk associated with connected medical devices. So, basically, the threat surface is increasing. So, my idea is our approach also should be security by design and default. When we start designing the product, we should introduce security there, and then that security comes up, as we have already seen in many of our customers, with customers when they came after the development cycle, the cost of security becomes multifold. However, when they start developing
last
security
question.
start in the beginning, it is very much appreciated, it is more effective, and even the cost could be reduced. So my advice is that yes, when you consider security, we should consider designing security from the inception phase, security by design and default. And as regard to the future is always bright.
Okay, thanks.
Thank you. Thank you so much, sir. So, as we draw our webinar to a close, I'd like to express my gratitude to our esteemed panelists and our engaged audience for the insightful contributions and thought provoking questions. We really got great questions, but because of the time lack of time, we are not able to attend each of those questions. So today we have explored the intricacies of securing healthcare IoT systems, navigating through the evolving landscape of remote patient care, data protection, and compliance with regulatory standards. We should remember the journey towards robust security in healthcare is ongoing. Let's continue to collaborate, innovate, and stay vigilant in safeguarding patient data and ensuring the integrity of healthcare system. Thank you all for your participation and dedication to advancing the field of healthcare security in IoT devices. And until next time, stay safe and secure. Thank you so much. Thank you, Dr. Ramesh, and thank you, Mr. Santosh, for
Thank you,
your time.
Niharika.
Yeah.
Dr.
For your
Ramesh, thank you guys.
Thank you
Thanks.
so much.
Yeah, yeah.
Good day.
Thank you, Niharika, Santosh, and the audiences. Thank you. Hope you have got some kind of knowledge from our end. Thank you. Thank you very much. Hare Krishna.
Thank you.
Namaste.
Thank
Thank
you.
you.
Yeah, yeah. Thank you.